CS is a 7-year-old female weighing 30 kilograms who presents to the emergency department for evaluation of a right upper extremity injury following a fall. CS has a history of one isolated febrile seizure when she was 2 years old, but is otherwise healthy. CS was playing on the monkey bars when she fell and landed on her right arm and hand. Upon further evaluation, CS and her parents clarified that she tried to stop herself from falling and landed on her right arm and wrist. There was no evidence of a head injury or abdominal trauma. Her parents report that they also have no significant family history, and CS has no significant medical history. Social history reveals that CS lives with her mom, father, and 2 brothers in a single family home. Her immunizations are reported as up to date. Upon physical examination, CS had not had any recent illnesses. She was neurologically intact. She answered questions appropriately, and her GSW was 15. Patient reports a pain score of 2 on the FACES pain scale. On exam, her respiratory effort was unlabored. She was breathing without issue, no shortness of breath. From a cardiovascular perspective, there is no significant cardiac history, there were no murmurs heard, and her heart rate and rhythm were in normal limits for her age. From an FEN and GI perspective, patient is able to eat a regular diet. She does not have any abdominal pain. She's urinating and stooling as expected according to her parents. Family also reports that she has no dysuria. From an MSK perspective, she has right upper extremity swelling of her elbow area and her wrist. There are no open wounds in those areas. No other pain. Legs are moving bilaterally. She's able to walk. CS demonstrated bruising noted on assessment. Family reports that these bruises are related to rough play with siblings. From a hematology perspective, she has no active bleeding, and family reports no family history of bleeding disorders. No additional concerning findings were identified on exam. The prioritized problem list includes acute right upper extremity injury following a fall, right arm and hand pain after a trauma, bruising noted on exam, and the need to evaluate for a musculoskeletal injury, including fracture versus soft tissue injury. From a health maintenance standpoint, her immunizations are current, she has appropriate family support, no chronic medications, and no significant chronic medical conditions. Her differential diagnosis are ranked from the following differential diagnoses are ranked from most likely to least likely. In this case, there are only 2. The first is a right supracondylar fracture. The pertinent positives are as follows. Given the mechanism of the injury involving a fall from the monkey bars, impact to the arm, and patient's age, a right supracondylar fracture is the highest on the differential. Pediatric patients commonly sustain this injury due to the anatomy of the child's arm. Specifically, the elbow area, the bone is thinner compared to adults. Pertinent negatives are as follows. No compartment syndrome, and patient is neurovascularly intact. The second differential diagnosis is a right distal radial fracture. Pertinent positives are as follows. Due to the swelling and inability to move wrist, reports of sharp pain immediately after the fall, as well as swelling. The pertinent negatives are as follows. No pallor in the wrist area, as well as no numbness or tingling. My impression statement. CS has a history of one isolated febrile seizure at age 2 years old, but is otherwise a previously healthy, immunized 7-year-old female presenting to the emergency department after a fall from the monkey bars. This resulted in an acute right upper extremity injury. She remains hemodynamically stable, with examination notable for bilateral leg bruising, traumatic right arm and hand pain without evidence of systemic illness or neurologic compromise. The leading diagnosis is a right supracondylar fracture as well as a right radius fracture, which have been confirmed by imaging. The diagnostic plan. Diagnostic evaluation should include imaging of the affected extremity, including including right hand, right wrist, right forearm, and additional imaging as clinically indicated based on tenderness and examination findings. Patient status and plan were discussed with the orthopedic team. Patient will be admitted to the trauma service overnight for pending definitive treatment in the OR. Neurovascular assessment should be performed and reassessed regularly, including pulses, capillary refill, sensation, motor function, and extremity perfusion. Pain assessment should be repeated throughout evaluation. The therapeutic plan. Pain management should be initiated with weight-appropriate analgesia such as acetaminophen or ibuprofen if clinically appropriate. Immobilization using splinting until patient can have surgery in the morning. We should also use ice application to the affected extremity and evaluation to help reduce swelling and discomfort. Orthopedics was consulted. So orthopedic consultation was obtained after imaging demonstrated a fracture for surgical management. When orthopedic was consulted, I informed them that CS is a 7-year-old female weighing 30 kilograms who presented to the ED for evaluation of a right upper extremity injury following a fall. CS has a history of one isolated febrile seizure when she was 2 years old, but is otherwise healthy. CS was playing on the monkey bars when she fell and landed on her right arm and hand. Upon further evaluation, CS and her parents clarified that she tried to stop herself from falling and landed on her right arm and wrist. There was no evidence of head injury or abdominal trauma. Her disposition. Patient will be admitted to the trauma service for overnight observation pending definitive treatment in the OR.